right? Here's the typical symptoms, how often do they come, and what people will talk about is the different stages of this type of infection, where you have either no symptoms, mild symptoms, that somebody gets tested before they have symptoms. Then you got the upper respiratory symptoms. And now you start getting to a little bit more worrisome stuff, the lower respiratory, the pneumonias, and something called ARDS, okay? By the way, keep this in mind, very important, very important. It's very important that you keep in mind that this co-infection issue exists, right? Depending on the studies, there are some suggestion that anywhere from 2 to 20% of people were co-infected, which means that maybe they didn't just have corona, they also had influenza with it. Or maybe they started out with corona, but then they got a bacterial infection on top of it, which is why you're going to have some people that took antibiotics and got better and said, oh, the Z-Pak is a great thing, right? Well, maybe it's a great thing because of its impact on other conditions and not the corona. Maybe it was because they had a bacterial infection in there, right? Now, ARDS, okay? So this stands for acute respiratory distress syndrome. Okay, so this is the bad guy. This is the one that we're very animated about. This is the one that we worry about. This is the one where you have the inflammation in the lungs, and you have these things. And when I talk to the doctor, so you can just ignore it. It was called diffuse alveolar damage and thrombosis, but just you can ignore that. It's a doctor thing when I do this for the doctors. But look. Here's one thing I want you to keep in mind. Please keep this in mind. Very important. Seems to have a day 47. Okay, what that means is, if I see somebody, they're otherwise healthy. Maybe they got a low-grade fever. Maybe they feel a little cough. Maybe a little shortness of breath. But their oxygenation is good. They've got good energy. You know, I will say, go home. If anything, stay away from the hospitals, right? But if days 4 to 7, you have a scenario where they start having high fevers, shortness of breath, feeling much worse, that's the warning sign. Get to the hospital immediately. That's the ARDS. That's the pneumonias. That's the more worrisome stuff, right? And they don't sit at home. That's an important thing to keep in mind, okay? ARDS has all kinds of complications. So it's not just the lungs. People that have ARDS from other conditions, because ARDS occurs in other conditions, has troubles with brain functioning, with psychiatric functioning, with inability to work. They get troubles in their heart. They get troubles in their nerves. They can have a lot of troubles from this infection, not just the lungs. When you're looking at the CT scans, this is what coronavirus looks like. It's these big patches in the middle here of infection, right? That's what coronavirus looks like. Here's another view of the lungs with this big patch right here, the big patch right here. Those are in the blue boxes. That's what it looks like. That's when you know it's worrisome, okay?